Morning, everybody. Yes, it's nice to have you around, and you can pity me having all the team of CEOs, and I have to address CEOs, isn't it? So just encourage me by waving at me. Thank you very much. So very happy to see you. As we introduced ourselves, the reason why we are here is that we are partners in this business together, isn't it? And talking about MEDS, I believe we are all here because we know what MEDS is. So I'll not dwell much in what MEDS is, but just briefly to remind us that MEDS was set up to facilitate, to assist health facilities in accessing medicines and medical supplies. We've done that since 1986. Our other functions, of course, include health advisory services, as Agnes Njue, who is there, will tell you more about it. It does more on capacity building. We have facility-based trainings. We have anything which you need to strengthen your systems that we are able to do. But we also have what we call the quality control, quality assurance section, where we are saying that quality is paramount in whatever we do. So we need to have quality in supplies, quality in services, and quality in everything. And MEDS has played a role in fighting against substandard and counterfeit medicines. So we are still continuing with that, and we have a WHO pre-qualified lab which does the testing of medicines. So the medicines which come to you, all of them have passed in the lab in one way or the other, either through when we are doing procurement, when we are doing tendering, or random sampling. We pick at least 50 samples every month from the supply, not because of purchasing, but medicines already purchased, and we test them. We want to see that quality is maintained throughout. So those are our key functions. We are about 32 years old, and we've achieved quite a lot with your support. Some of the standards we maintain, we have the ISO standards, we have WHO, we are pre-qualified by ECHO, which is the European Union quality standards. So they've pre-qualified us. So if you have donor funding from any European country, we are pre-qualified to supply to you. We are also pre-qualified by FDA, a US agency. So if you are also funded by US agency, we are one of the few, I think there are 9 organizations in the world pre-qualified to supply for US funded emergency programs. So that's where we are. But this time we are not talking about that part. We are talking about a strategic plan, which came in effect this year. It's a 5-year strategic plan. We've talked about it, and we've stopped talking. Now we don't want to talk about, we have a strategic plan. This, we've started implementing it. And it has 3 pillars. The first pillar was what was it? Growth and performance, performance and growth, yeah? Performance improvement and growth. The words are getting lost. So one of them is performance improvement and growth. The second one is partnership, and the third one is diversification. So when we go to performance improvement and growth, that is inwards. So it's us MEDS to see how we can improve ourselves, how we can grow ourselves. And that is aimed at giving better customer service so that we can serve you better. So that is the first pillar. But we are also saying that as we are growing and building our capacity, we are believing and we are supporting you to also grow and build your capacity. Hence the health advisory system, which will work with you, and any need, we need to grow together, because if you leave us behind, then we can't catch up. And if we leave you behind, then we'll not be able to work together. The 2 major pillars which bring us together this time is partnership and diversification. And when we talk about partnership, is that We can't, these days you can't do it alone. We realized that we can't do it alone, so we decided we have to embrace partnership. And through partnership, we brought you together so that we partner together to be able to move forward. When we had just as we are developing this strategic plan, what was very obvious that time is that diverse devolution of health services had taken place. So we took that into consideration and we said, if we have to really serve you better and you are working in counties, we have to go to the counties. We have to work with the counties. So we are working with the counties so that in that reason they support you and we support each other. So that is one of the way where we saw. But one of the things which changed from the time we formulated our strategic plan is the universal health coverage. That was not there at that time. So it's an emerging trend, which now fits within the strategic plan because we had already thought about it, that we need to have universal health coverage. And that's why through partnerships, we were also saying that we are partnering with other organizations, multinational companies, so that we increase access to medicines. So I believe you've all enjoyed the access prices. Medicines we never thought we can get, we are able to get, and they are affordable. So that is part of the partnerships which we are doing. And we are trying, as we saw the suppliers of equipment coming here, we've really partnered so well in medicines, but we hadn't done very well where medical supplies are and where equipment is. So by bringing this team together, it's saying that we are still exploring our partnerships so that we can work together. So that is the partnership we are talking about. We are partnering at the national government, and we are partnering at the county level. We are partnering with you so that we can move together, but we are also partnering with suppliers, manufacturers. In fact, in the name of partnering, we even had a group of med staff who went to India, Pakistan, Oman, and China. Yeah, so they've gone to all those places trying to establish whom can we partner with. Because one of the things we are realizing is that there's a lot of exploitation. Because of ignorance, we don't know where these items are coming from, so we are able to get poor quality items, and of course they are very inflated in prices. But when you go to the source, you can identify the good quality products, you are able to bring them in, you are able to maybe cut the middlemen, but also able to drive down the prices. As long as we remain ignorant where equipment is concerned, it will continue being exploited. And of course, there was this design initiative which had come, and we really embraced it. And we are saying that the suppliers will come and place equipment in your hospital, isn't it? And it was nice because you don't have to invest anything. But how do they recover that money? It's because they exploit you on the supplies. The kits and everything you are using in that machine, they've tied you for many years. And because you are only able to get the reagents from them, that means they dictate the price and you cannot do anything about it. So when they said the price is here, you just have to say yes because they gave you that equipment. So we've realized that's a lot of exploitation which is taking place. How can we do? We can work with those people who place the equipment to drive down the prices. Or we can also become a player so that we also come, whatever, the way we've made ourselves strong. In fact, when you go around, people will say, what do you know about meds? Quality medicines. But we hardly talk about quality supplies and equipment, isn't it? So now we are saying in our third pillar of diversification, now we are going to start talking about equipment. Because we realize as over the period, especially now let me talk about the faith-based facilities.